Here's a clear overview of the most common nutrient deficiencies in women, why they happen, and practical ways to correct them, including foods to focus on and an approximate timeline for improvement. Timelines vary with the severity of deficiency and individual health, so always confirm with a healthcare professional. Iron. So why is it common? Well, blood loss from menstruation or childbirth is a big factor. There's also increased needs in pregnancy, and sometimes a low intake of red meat or fortified foods. Now, how can you improve it? Pair iron-rich foods with vitamin C, since that really boosts absorption, and it's a good idea to limit tea and coffee with meals because tannins can reduce absorption. Wondering what to eat? Lean red meat, chicken, turkey, lentils, beans, tofu, spinach, pumpkin seeds, and iron-fortified cereals are all great choices. As for how long it takes, mild deficiency can improve in 1 to 3 months with diet and supplements if prescribed. For moderate or severe cases, it's often 3 to 6 months of iron therapy to fully replenish stores. Vitamin D. Why is this one so common? Limited sunlight, sunscreen use, or living in northern latitudes can really make a difference, and folks with darker skin tend to have less vitamin D synthesis. Oh, and please like, share, and subscribe. So how do you improve it? Safe sun exposure, 10 to 20 minutes a few times per week, can help, but supplementation is often needed, especially in winter. When it comes to food, think fatty fish like salmon, sardines, or mackerel, as well as fortified dairy or plant milks and egg yolks. You might see your levels rise within 8 to 12 weeks of supplementation. Calcium. Why is it common? Well, low dairy or fortified food intake is one reason, and there's an increased need after menopause, since lower estrogen leads to bone loss. To improve things, try to distribute calcium-rich foods throughout the day for best absorption. Good options include milk, yogurt, cheese, fortified plant milks, leafy greens like kale or bok choy, almonds and tofu set with calcium. As for how long it takes, bones strengthen over months to years, so aim for consistent daily intake. Folate, also known as vitamin B9, is a nutrient that many people can be low in, often because they don't eat enough leafy greens or legumes. Alcohol use and certain medications, like anticonvulsants, can also increase your risk of deficiency. So, to improve your folate levels, it's best to eat folate-rich foods every day. And if you're planning a pregnancy or already pregnant, definitely consider a supplement. Good choices include dark leafy greens, asparagus, avocados, beans, lentils, citrus fruits, and fortified grains. The good news is, with regular intake, your blood levels can improve within just a few weeks. Number 5, vitamin B12. So, why is this one so common? Well, it's often seen in folks who follow vegan or mostly plant-based diets. There can also be absorption issues, like with pernicious anemia or certain gastrointestinal disorders. Now, how can you improve your vitamin B12 levels? Basically, you'll want to include animal products in your diet, or go for B12 fortified foods and supplements. What should you eat? Think fish, poultry, eggs, and dairy. For those on a plant-based diet, fortified nutritional yeast and plant milks are good options. And how long does it take to notice improvements? Symptoms often get better within a few weeks, but nerve-related issues might take several months to fully resolve. Number 6, magnesium. So why is magnesium deficiency pretty common? It's often down to diets high in refined or processed foods. Plus, you can lose magnesium from stress or certain medications, like diuretics and proton pump inhibitors. To improve your magnesium levels, focus on whole, unprocessed foods. What should you eat? Nuts, seeds, and whole grains are great choices. Don't forget dark chocolate, leafy greens, and legumes as well. And just so you know, blood levels of magnesium can improve within 2 to 4 weeks. Number 7, iodine. Why is iodine deficiency an issue for some people? It usually comes from low use of iodized salt, and needs are even higher during pregnancy. To improve iodine levels, use iodized salt in moderation, and try to eat iodine-rich seafood a couple of times each week. What should you eat? Iodized salt, a bit of seaweed like nori or kelp, fish, dairy, and eggs. As for how long it takes, thyroid hormone levels may normalize in a few weeks to months, depending on how severe the deficiency is. Alright, here are some general tips. Aim for a balanced plate, half vegetables and fruit, a quarter lean protein, a quarter whole grains, And add some healthy fats. Make sure you get routine checkups, including blood work, to track your nutrient levels and guide any supplements. Lifestyle matters too. Manage stress, exercise regularly, and try to limit alcohol and smoking for better nutrient utilization. It's important to know that severe deficiencies often need prescribed supplements in specific doses. Food alone might not be enough at first. Always follow your healthcare provider's guidance for dosing and duration. Thank you for watching. Please like, share, and subscribe.